At the beginning of August 1793, Dr. Benjamin Rush noticed a pattern that he hadn't seen in 30 years. Men and women from teenage up, all either living or working near the docks, began showing signs of jaundice. Some even began bleeding from the mouth, nose, and eyes, as well as black vomit, a telltale sign of bleeding in the stomach. Dr. Rush, as an apprentice to Dr. John Redman in 1762, witnessed firsthand one of Philadelphia's major epidemics of yellow fever. By November, thousands would be dead in one of the deadliest outbreaks in American history. The yellow fever virus is an enveloped RNA virus that is grouped together with other hemorrhagic fevers and is in the family Flavridae, which includes the dengue fever and West Nile viruses. Yellow fever is spread via mosquitoes, namely the Aedes aegypti, literally the hateful of Egypt, or the yellow fever mosquito. Though other mosquitoes can carry the virus, the yellow fever mosquito's saliva uniquely aids in infection. Aedes aegypti spreads 52 viruses, including the ones I already mentioned. They also spread Zika and 2 plasmodia, both malarias that affect chickens. Yellow fever originated in either East or Central Africa before spreading widely across tropical Africa, and was carried to the New World by enslaved Africans. The slavers also brought Aedes aegypti either as stowaways feeding off the crew and cargo, or as larvae and eggs carried in infected water barrels. Once in the New World, the mosquitoes spread yellow fever like wildfire, the first recorded outbreak occurring in the Windward Islands in 1647. By the next year, symptoms were recorded in the Yucatan among both Spanish and Mayan populations, who suffered heavily. Europeans and Native Americans had no prior contact with yellow fever, and the death rates among those populations increased the need for a more disease-resistant labor force, namely Africans, who did have some immunity to Old World tropical diseases, creating a feedback loop spurring the further importation of slaves to the New World. Sugar plantations were a hotbed for mosquito breeding, owing to the conditions needed for cane growth and sugar refining. Among the colonial population, yellow fever was known as Yellow Jack or Bronze John. As the disease progressed past its early flu-like symptoms, it began to attack the liver, leading to the victim's skin gaining a sickly jaundiced yellow tone, before quickly revealing why they are called hemorrhagic fevers. Philadelphia had been a hotbed of a different type, since long before the Revolution, the Quaker-founded society on the Delaware was a progressive experiment. From its laws to community planning, everything was ahead of its time. As the population expanded and American society became more complex, the independent streak the colonists required began to chafe against the rule of the largely absentee British aristocracy. Philadelphia was one of the leading cities calling for independence, owing to its large population, liberal-minded populace, and central location among the colonies. Philadelphia became a natural hub for the growing liberty movement. America's founding fathers met in Philadelphia at Independence Hall to draft the founding documents of what would be the United States. The resulting government remained in Philadelphia, though they were forced to flee a number of times during the war due to the advance of the British Army. After the war, Philadelphia remained the capital, but a veterans' protest over not getting paid for their service during the war, the first of many such events involving the federal government and veterans, turned into the Pennsylvania Mutiny of 1783, spurring the fledgling government to call for a purpose-built capital on the Potomac. As these plans for what is Washington, D.C. were drawn up and executed, Philadelphia remained the capital for the rest of the century. While yellow fever was no new disease to the city, as mentioned before, Benjamin Rush had been an apprentice during an outbreak 31 years previous, and there had also been outbreaks before that. but the Philadelphia of 1793 and 1762 were entirely different places. In addition to being the center of politics in America, Philadelphia was also the second largest city in the country. In 1730, the estimated number of people living in Philadelphia was around 12,000. By the first official census in 1790, that figure was 28,522, not counting the surrounding, less, but still relatively, densely occupied outskirts, which brought the total of what we would consider as the metropolitan area to about 50,000 people. Concurrently, beginning in 1791, the Haitian Revolution started. By the summer of 1793, many French slaveholders had fled the doomed colony of Saint-Domingue with their slaves, a total about 2,000 landing in Philadelphia. These refugees are most often believed to have been the vector for the following outbreak of yellow fever, carrying both Egypti mosquitoes and the virus in their sick. That said, a second vector has emerged. Montana State University professor of history Billy G. Smith, in his 2013 book A Ship of Death, A Voyage That Changed the Atlantic World, suggests the British ship Hankey, fleeing the failed colony on the Bisagos island of Bolama in present-day Guinea-Bissau, left a trail of yellow fever at every port it landed from the Caribbean up the Atlantic seaboard. Regardless of the specific vector, now in Philadelphia the mosquito-borne virus was unstoppable. Late summer in the eastern shores always was associated with disease. Even in the relatively well-regarded northern portions of the mid-Atlantic states, such as New York and Connecticut, fevers weren't uncommon. Among the planters of Virginia, and lower down in the Carolinas and Georgia, the profitability of lowland planting areas was balanced out by their tendency to strike down any and all who dwell too long in their stagnant marshes and creeks. Even imported Africans with some immunity to tropical diseases inherited from their ancestors had a hard time staying alive. The Europeans died like flies, irrespective of wealth and status. When the dog days of August brought clouds of biting flies and mosquitoes, some always died. For a closer look at this, I recommend a read at David Hackett Fisher's book Albion Seed, specifically the section on the Chesapeake environment. The first to die in the outbreak were a refugee and a recent Irish immigrant, both of whom were attended by inexperienced doctors that could unfortunately only make things worse and record symptoms. Like most doctors through history when faced with such a disease, including Dr. Benjamin Rush, the response was hamstrung by the dismal state of medical science at the time. While the last few decades saw improvements, the first steps in inoculation were embraced by the American Army, famously using relatively benign cowpox inoculations to prevent the much deadlier smallpox outbreaks that ravaged their soldiers. The late 18th, 19th, and to some extent the first half of the 20th centuries were not a place you wanted to have a toothache, much less some horrific tropical disease. After the reporting of these initial infections, the number of cases steadily grew. Within 2 weeks, Dr. Rush alerted Pennsylvania Governor Thomas Mifflin, who tasked Philadelphia's port physician, Dr. James Hutchinson, with investigating the state of health around the docks. Dr. Rush blamed the outbreak on discarded rotten coffee beans he had found stinking up the wharf at the end of Arch Street. Dr. Hutchinson's survey of the surrounding area found that of the 400 residents in the area, 67 were ill, 12 of whom had malignant fevers. Towards the end of August, the outbreak was obvious. Whole families were stricken with the virus. On Arch Street alone, 6 had died within hours of each other by August 19th. Soon thereafter, a committee of doctors headed by Benjamin Rush convened and drafted 11 measures to avert the spread of yellow fever. Most of these recommendations weren't too helpful. They included putting vinegar and camphor-soaked rags over your face to prevent the malaria from entering your body. Malaria not being malaria, but bad air, which was indicated by Rush believing that those coffee beans were the cause of this outbreak. Other measures included suspending the tolling of funeral bells and the cleaning of the streets, which I guess would be more positive for morale than anything to do with health as we know it. The refugees from Saint-Domingue were quarantined. Unfortunately, the mosquitoes were hard at work plaguing the people, and the quarantine could not do anything. As the panic among the citizenry rose, the quarantine became unenforced. Soon the refugees were the only people on the streets, owing to their natural immunity. Literature from a yellow fever outbreak that took place in Charleston, South Carolina, indicated that black people had some immunity to the malady, spurring a call for black nurses and other essential workers to come and help the sick and bury the dead. Many black Americans, most of Quaker faith, came to assist. Unfortunately, these black friends were mostly American-born and northern-raised, thus had no prior exposure to yellow fever and consequently no immunity, dying at the same rate as their white neighbors. Hospitals in the 18th century had a strict no infectious disease policy, likely to prevent such diseases from scything down the weak and vulnerable patients already being treated there. As such, temporary hospitals appeared wherever they could. Notably, one such facility was the manor of lawyer Andrew Hamilton, no relation to Alexander, Bush Hill, then owned by his grandnephew William Hamilton. At the time, the 150-acre estate's main house was rented by then Vice President John Adams. The estate was commandeered by the city of Philadelphia's Guardians of the Poor, appointed officials whose duties included providing care and relief to the poor, in this capacity overseeing public health. Let's talk a bit about medicine in this era. Medical theory was still fundamentally based upon humorism, the ancient Greek system of medicine which may have its roots in even older Egyptian and Mesopotamian practices, in which 4 elements within the human body, phlegmat, phlegm, sanguine, blood, choleric, yellow bile, and melanch, black bile, through some outside intervention, fall out of balance and cause disease. While the era of humors was coming to a close, the practice was still the basis of medical knowledge at this point in time, and as such, all medical treatments were informed by an imbalance of humors. The favorite treatment for yellow fever was bleeding. It makes some amount of sense if you can stand for a moment in the buckled shoes of an 18th century doctor. Well, look at that. Your skin is yellow and you're bleeding from your eyes. That must mean you have too much yellow bile and blood. Wait right there. I'll get my leeches. Needless to say, however good intentioned the doctors attending you, the Hippocratic Oath was violated. Bleeding, while the old reliable of any doctor's tool bag, was not the only trick they had up their sleeve. Alchemy, herbs, and potions were also an essential part of any serious physician's kit. That's not saying herbs and potions can't be effective because a pharmaceutical company hasn't given it a funny name and marketed it. I mean, really, what is lemon tea with honey if not a potion? And it's often just as good at soothing a sore throat as a shot of Robitussin. But I'm getting off track. If you're vomiting blood, no herbs or any amount of mercury will save you. Bringing up herbs and mercury gets us into a nice spot for me to cast some aspersions on Dr. Benjamin Rush. While it may seem I've made Rush the main character of the story, I don't really think he deserves any credit for anything past recognizing that there was yellow fever about and informing people. Dr. Rush was very active among the liberty cause before, during, and after the Revolutionary War. Upon the end of the war, going so far as to declare the revolution ongoing, not unlike later revolutionaries of other stripes. Thomas Paine consulted Rush while writing his seminal work, Common Sense, and Rush was one of Pennsylvania's signers of the Declaration of Independence, making him an important figure in the early republic's history. Before the war, Rush became America's foremost expert on chemistry by publishing a textbook on the field, as well as several instructional guides for medical students. During the war, Rush accompanied the Continental Army in the field and was even appointed Surgeon General, a post whose duties he was unable to fulfill, resigning in 1778. That said, Rush was a product of his time, and one of the giants on whose shoulders our civilization stands on. For me to be too hard on him is unfair. Time has a way of proving all of us fools in one way or another. During the outbreak of yellow fever, Rush concocted a mixture of equal parts calomel and jalap to be administered in 20-grain doses 4 times a day, what Rush coined as heroic doses. Calomel, also called horn quicksilver, is the rare natural occurrence of mercury chloride, and was a favorite for its qualities as a panacea, to which Rush spent the remaining years of his life espousing. Jalap is the ground root of the Mexican morning glory species Epidemic, which, in addition to its powerful laxative properties, is, of course, very poisonous. Rush prescribed this concoction widely, even running out of the ingredients, but I wouldn't necessarily call it snake oil, because after falling ill with yellow fever himself, Rush began taking heroic doses, and believed for the rest of his life that the mixture is what cured him, though unfortunately, it didn't do the same for his sister, or many of his patients. Calomel may have also contributed to King George III's growing insanity, as the king's physician prescribed large amounts of the powerful laxative. During the epidemic, Dr. Rush published a popular pamphlet, Dr. Rush's Directions for Curing and Treating the Yellow Fever, which, in addition to outlining symptoms, provided a handy guide for treatment of the fever, which included lots of fluids, including chicken broth and barley soup, as well as using his mixture to produce 4 or 5 large evacuations from the bowels every 6 hours, to be followed by bleeding between 8 and 10 ounces of blood 4 times a day, every 6 hours, and we wonder why so many people died. Those in the know quickly began to flee from the city after Dr. Rush raised the alarm that the fever was about. George Washington, in addition to the other Southern politicians and those of the planter class, left before or in very early August. By early September, 20,000 people of all strata, including the Philadelphia Common Council and the rest of the federal government, fled the low-lying areas of the Delaware Valley. Most of the city government fled after a man was found lying dead on the steps of City Hall while the councilors were meeting, leading to the assembly being adjourned early. Those that failed to flee by the second week of September had any escape efforts hampered by a federally declared quarantine of Philadelphia, which included roadblocks and Pennsylvania militia patrols. Many surrounding cities refused fleeing Philadelphians entry. New York and Baltimore set up quarantine camps, and New York set up a committee to oversee citizen patrols to enforce the quarantine. Havre de Grace, Maryland, refused Philadelphians access to cross the Susquehanna. Various towns, such as from Trenton to Bordentown in New Jersey, passed resolutions preventing any boat from disembarking, with Trenton further preventing landings as far as 4 miles upriver. The other states up and down the coast from Massachusetts to Georgia had all issued quarantine orders. Some only stipulated ships from Philadelphia must quarantine, but Virginia ordered any ships from the Caribbean had to quarantine as well. Most quarantines were not to exceed 20 days, with some like Georgia ordering mandatory quarantines of no more than 30 days. But New York had a mandatory 40-day quarantine. Boston had a mandatory inspection. In addition to the quarantine, all ships and cargo were to be sanitized with vinegar. That said, there were cities that encouraged the Philadelphian refugees. Woodbury in Gloucester County and Springfield in Burlington, both just across the Delaware and New Jersey, built hospitals to treat refugees. Elizabeth likewise invited Philadelphians and set up a hospital by mid-October. To the direct south of Philadelphia, Chester, Pennsylvania set up hospitals and camps for the refugees. When the news that Havre de Grace wasn't allowing refugees to pass, Elkton invited the Philadelphians and set up a hospital as well. Mayor Matthew Clarkson rallied the remaining people of Philadelphia to join with the Guardians of the Poor. Those that did formed a committee to take over the specific response to the epidemic. While well-intentioned, the Guardians of the Poor were out of their depth when it came to the situation, and the sick languished due to poor organization and crisis response. The 26-member Mayor's Select Committee drew their authority directly from Mayor Clarkson, who was one of the members, and completely reorganized the city's response. In mid-September, local cooper Peter Helm and French merchant Stephen Giard, members of the mayor's committee, took control of Bush Hill. The duo found the facility in utter chaos. The dead and dying were jumbled together, with the sick to the point where the nurses couldn't tell who was who. The committee members reorganized the facility. Most of the beds used by the patients were broken, with the majority of patients simply lying on the ground. Helm had the broken beds repaired, and more cots brought from the prison. At the time of the takeover, Bush Hill was treating under 60 patients. By the epidemic's end, the facility had a capacity of 140 patients. The patients were reorganized into something roughly approximating triage, a practice whose founders, Baron Dominique Jean Leray and Baron Francois Perry, were developing in France. The sick were divided roughly into those with a chance and those without a chance. Those that seemed to be recovering were moved to the property's barn to convalesce, while the dead were quickly moved out of the main hospital area. Unfortunately, this hospital, however efficient, still had a death toll approaching 50%. Now, while this could mean that the practices of the staff, specifically forcing the patients to have diarrhea and then bleeding them, no doubt had an effect on the survival rate, only the sickest would have been transported to the hospital for treatment, so it's likely most would have been on death's door already. The dead were taken from Bush Hill, formerly located on Spring Garden Street, before it was demolished to widen said road in 1875, to the Potter's Field at North 19th Street and Fairmont Avenue, which at this time was just on the other side of the road from the property. A Potter's Field is a sort of public graveyard. Usually Potter's Fields were only reserved for people who either couldn't pay for a proper burial or were unidentifiable strangers. In times like these, Potter's Fields were used to quickly bury those who couldn't get a grave in their preferred yard, but needed to be dealt with in an era before refrigeration. Usually in times of plague, people would be reburied later on, but often, as with the Potter's Field at North 19 in Fairmont, after a few years, people had no problem with just building right over them. As recent as 2009, bones were found when a house in the 800 block of North 20th Street was being renovated, indicating that this field, which started here at Fremont Street, extends at least as far as Parrish Street. It's worth noting that Eastern State Penitentiary is only a bit west down Fairmont Street, certainly not helping the ghost problem there. Many locals returned when reports of a hurricane hitting Philadelphia convinced them that the storm would have once and for all blown away the bad vapors causing yellow fever. Nothing could have been further from the truth. The storm merely increased the amount of standing water in the area. Paired with an unseasonably warm October, the death toll spiked between the 7th and 14th to over 100 a day before returning to its average of 30 deaths a day. After that, the death and infections slowly ramped down. By the 25th, many businesses began to reopen. The epidemic was declared over on Halloween when a white flag was sent up at Bush Hill, signaling that there was no longer any sick patients there. Assuming, since it was November, that the fever season was over, the government and most of the rich began to return, but November followed October in its unseasonable warmth. A hot spell in the first week of November drove a wave of infections through the 14th. While the white flag over Bush Hill had to be pulled down for the duration, it would be re-raised for good on the morning of the 15th. All in all, official records indicate that 4,044 people died, but grave records indicate that number was much higher. Also, deaths outside of Philadelphia, as well as deaths among the fleeing refugees, are unknown. Immediately after the end of the epidemic, publisher and economist Matthew Carey released a short account of the malignant fever, lately prevalent in Philadelphia, a book containing accounts, meteorological observations, records of burials, and a list of notable citizens who perished since the 1st of August, for which the book became a bestseller. This outbreak was both the first and the worst of a series of outbreaks later in the decade in both Philadelphia and other cities, namely Wilmington, Delaware, and Boston, Massachusetts. Two other notable outbreaks took place in Philadelphia in 1799 and 98, both killing 1,500 and 3,600 people respectively. In the wake of the last outbreak, Noah Webster of dictionary fame used data published in his Medical Repository magazine to publish A Brief History of Epidemic and Pestilent Disease, in which he suggested that the United States is subject to a widespread epidemic constitution. From what I understand, he believes this to be almost like a miasma that he claims may last as long as 50 years and would ensure continued epidemics. Almost 90 years later, the account of Dr. Benjamin Rush inspired the Cuban Dr. Carlos Finley to investigate whether mosquitoes had anything to do with yellow fever. Dr. Rush had come surprisingly close to the answer Dr. Finley would find. Rush complained that the mosquitoes, going so far as to directly mention they were attendants of sickly autumn, were more numerous than usual. Unfortunately, Rush was not scientifically equipped to put two and two together, and Finley would put forward that mosquitoes of the genus Aedes were responsible for the transmission of not only yellow fever, but other tropical diseases. Walter Reed would confirm Finley's hypothesis, making life a lot easier in the tropics and paving the way for the eradication of mosquito-borne illnesses in America, as well as the construction of the Panama Canal. The last outbreak of yellow fever in the United States took place in New Orleans in 1905, killing upwards of 41,000 people. Since then, better drainage in cities and marshes, as well as overuse of DDT, has eradicated yellow fever in the United States. That said, the Aedes aegypti mosquito's range is expanding with increasing urbanization, Individuals that manage to find a good place to hide can survive winter and harbor diseases from year to year. While there is a vaccine for yellow fever, there is no cure once you have it. 15% of people infected will develop the severe form of yellow fever, and half of those people will die. While the worst thing you're likely to get from Aedes aegypti this summer is a few itchy bumps, remember that statistic the next time you see some standing water that you can knock over.